If your home care agency has been hemorrhaging staff, it's time to make some changes before your bottom line starts to suffer. Even if your retention numbers are fine now, it's prudent to have a plan to support your staff and keep them satisfied about working in your agency. You certainly don't want to give them any reason to leave you for one of your competitors. Clinical employee retention is crucial for maintaining continuity of care for patients. It ensures you can run a stable business optimized to address the needs of current and future patients. After considering factors such as wages, benefits, and time for vacations and family leave, you also have to think about the onboarding process and education and how they impact your team. Employees consistently wrote in exit interviews that the orientation was inadequate. They felt thrown out on their own before being ready to safely provide care. With that in mind, have you thought about what robust educational programming brings to the table? Have you ever considered education as a retention measure for home health aides, therapists, and nurses? Home health aides represent the highest turnover rate. A high level of churn among home health aides may have discouraged you from investing in their education. But since one of the biggest costs in healthcare relates to chronic illness, it makes sense to allocate resources for chronic disease education. If you reward your team with a pay raise associated with their chronic disease certification, you can anticipate keeping more of them on staff. With training, you'll elevate the knowledge base of your staff along with their clinical capabilities. Review your documentation to see whether visits made by a therapist or RN could have potentially been made by a less costly home health aide. Doing so will maximize your team's efficiency. Do your nursing professionals have to make extra visits into the home because your therapy providers are unable to address medication issues or offer simple wound care? Offer your therapists education so they can be more competent in areas where they might not currently feel comfortable. Empower your nurses by giving them education so they can provide better case management for your patients. As nurses feel more empowered with new knowledge, they are less likely to quit your home care agency. You can improve the care you provide to Medicare home health patients and boost revenue when you offer comprehensive OASIS training to RNs and therapists. With proper training, your team will use OASIS to better plan care and determine more accurately the reimbursement you are due for services. If you're looking for quality education to help your staff become better at providing care to patients, contact us for a consultation. The professionals at Kenyon HomeCare Consulting offer expert guidance to meet the ongoing educational needs of agency and staff. Call us today at 206-721-5091 or visit the Kenyon HomeCare Consulting website at www.kenyonhcc.com.